So, yeah, so, when 3IE asked me to do this talk, I was thinking about what I should talk about. And this is sort of an unusual talk for me to be giving from an Ideas 42 point of view, because although I'm going to talk about 3 behavioral interventions, I'm going to talk, it's structured around a kind of intervention. And a lot of times, we spend a lot of time, especially when talking to policymakers, saying that, the first question you're often asked is, what should we do? And the answer usually given is, well, we don't know until we've looked at the problem and sort of thought about what could be going on and, what the possible solutions could be. So this is the way you kind of present studies after they're done. So it all seems very neat and linear, and we knew what we were doing. And that's not really how it happened. And so in some cases, I'll try to give you a little bit of color about that as well, because there are a lot of interesting things that one learns just about the process of kind of doing these kinds of experiments. But this is the brief structure of what I'm doing. I'm going to talk a little bit about the unifying idea that sort of unites these 3 experiments I'm going to talk about, and then I'm going to talk about each of them in turn. I don't know how familiar people here are with sort of behavioral science or behavioral economics, so I'll do this sort of fairly quickly. But the idea is really that behavioral science is something that challenges the traditional economic model of decision making. And this is, of course, an extremely stripped down and overly simplistic model of economic decision making, which pretty sure Adam Smith would sort of scoff at, because there's a lot more in the traditional model. But there is this sense in which, at least the way we use it in applied work, we think of it as sort of weighing up benefits and costs and things happening or things being done if the benefits exceed the costs. And that's a pretty reasonable formulation for a lot of things. And when you have that formulation, these are some of the kinds of things you think about in thinking about what might happen in a particular situation. So you think about how much things cost, whether things are worth it. You think about the benefits or the net benefits of different kinds of options and stuff like that. Now, where behavioral science comes in is really as a way of kind of complicating this model. And it does that really by using a lot that we've learned from some allied fields like psychology, which say, well, things like prices, things like costs and benefits are extremely important. But if you look at how human beings make decisions, that's not all that matters. There are a lot of things which, broadly speaking, economics would say shouldn't matter, but which, when we look in practice, look like they actually have quite a bit of influence in what people do. And the way you can think about this is, there are many more things one could add here, but in sort of going from a decision to an action, it's possible that someone doesn't make a decision at all. And that's where things like defaults and things like the status quo become incredibly important. So what happens if I decide to do nothing? Well, something probably still happens, right? And that is often in many situations where we wind up. Often the process of doing something might alter your decision, right? So I might have decided to do something, and then as I start to do it, I realize more and more how difficult it is, or how unpleasant it is, or get distracted by other things, and then I end up in a different place than where I thought I was going to be. And so when you take this sort of, within quotes, behavioral view of the world, you start to think about a few more nuances of sort of the benefits and costs. So for instance, you might think about how costs and benefits are staggered over time, because for many things, we might face upfront costs of doing something, and the benefits lie far in the future. And if you think about a lot of stuff like the decision to get an education, right? I mean, the traditional economic model is, well, these are the returns to education, right? But when do those returns accrue? They accrue when you've finished education, which, as I think all of us in this room know, is a long and arduous process, right? So it's sort of easy to not necessarily get there in the end. So there are a bunch of other things. And today, what we're going to focus on is, what are others like me doing? Which, again, is something which, if you think about straight up sort of costs and benefits, shouldn't really matter that much. But if you think about how we really make decisions, it's an incredibly important sort of determinant of what we do. We had tea and biscuits outside, and I didn't notice anyone who went and just sort of took the entire plate of biscuits and walked in. And that wouldn't really happen, because it would feel like something that would really violate sort of the implicit social norm about how one behaves at nice IIC seminars, which is you definitely have some tea and some biscuits, but you don't take the lot, right? So there are many ways in which, where are we sitting? Are we sitting with people we know already? At what time did we show up? All of these things, how did we get here, right? Probably influences some measure by what's going on around us, what we think is sort of the normal thing to do. So this is an attempt to define this idea in behavioral economics, which is social influence, which is that the real and implied presence, behavior, or opinion of others has an effect on our behavior and on our mental processes, our decision making. That's, I think, meant to be a picture of, like the famous Stanford prison experiments, where those of you who haven't heard of them should go and look them up because they're fascinating. We don't have time to talk about them right now, but they really are an example of how you could also use social influence in very bad ways. But hopefully what we'll talk about today is a little bit more positive in terms of trying to use these. But an allied idea then becomes this concept of social norms, which is rules or standards understood by a group that guide or constrain their behavior. So the picture here, is of a subway system. Pretty sure it's the London Underground. And there's a convention about which side you stand on and which side you walk on. And you can see that, and you could sort of model this in game theoretic terms and say, how did we come to this convention? But what we know is that when we see this kind of convention in play, it sort of both makes sense, and it's sort of the thing we're going to do is more or less abide by that. If you start walking where people are standing, then you might get some uncomfortable looks from people, and things might go downhill from there. And a little bit of nuance is that you can think about social norms as being either prescriptive or descriptive. So about whether what you should be doing, that's more prescriptive, or your sense of what other people actually do. I'm glad there are at least a few Americans in the room, so the second picture makes sense to more people than it might in a few other places. So this is, and so how does this usually play out? So this is this classic experiment by Robert Cialdini, where essentially what's happening is you're being tricked into thinking that the survey form that you're filling out is the real experiment. The real experiment happens when you leave the experiment room and you go into a parking lot. And the parking lot is either already littered with lots of paper or it's clean. In addition, there's an actor who's in the act of littering or is not, or is putting the paper into a dustbin. What you see is that in general, when you see someone else littering, you litter more. But you do it even more when all around you is already very dirty. And I think actually, when I think of this experiment, it always reminds me of the Delhi metro, because it's always very striking to me that very few people litter on the metro, and the same people will go outside and will litter away. And that's because the metro is generally clean. And so you would sort of really stand out if you were throwing something on the floor. But once you're out on the street, all bets are off, right? So, but it's the same people, right? I might behave very differently in two different situations because of what's going on around me. So, and one of the final thing I'll sort of say about this is that there are often these really stark differences between what people think other people are doing and what other people are actually doing. Now, this could go in a variety of directions, but this is an example from the US where you're looking at reported and actual use of certain kinds of, so the reported is basically what people think is, what percent of the population does X, and the actual is what, when you ask people, are you doing X, right? And you see these big gaps. So people, when it comes to alcohol, there's not much difference. But when you come to something like cigarettes, people think that a lot more people are smoking than actually are. And if you think about why that is, it's often because certain behaviors are much more visible than others, right? So we don't notice the people who are not smoking, but we definitely notice the people who are smoking, and what happens is that we sort of overstate that in our minds, and we see a couple of people smoking, we extrapolate from that and think that a lot of people smoke, right? So that's kind of the way this works. So what this means is this becomes a little bit of a lever to pull. So in a lot of situations, we don't actually know what other people are doing, and if it turns out that what other people are doing is in some way helpful or more positive, that becomes a very simple kind of intervention where I can just tell you, this is kind of on average what's going on. And because in many situations, because we're taking our cues from other people's behavior, this then gives us a bit of a handle on how we might want to behave. And you can imagine that this could go in all kinds of directions, not all positive and not all useful, right? So when you see a lot of other people littering, you litter, and that's not probably a behavior that we want to encourage. So this kind of feedback can be useful. Anybody who has recently lived in the US has probably got one of these at some point. This is a mailer from this company called Opower, which has sort of taken this idea and commercialized it at scale. So what they do is they send you these letters with your bill, your electricity or your gas bill, often both, which just tells you how you compare to your neighbors. And they'll usually tell you your neighbors on average, your most efficient neighbors, and you. And even when, like me, you've been using Opower as an example in presentations for several years, when you get that thing, and I just got one before I got here, and suddenly we've gone to being like way worse than average, and definitely a lot worse than the most efficient. So, I mean, the day before coming, I was having some conversation with the window guy about like repairing the insulation on one of the windows. So it sort of spurs you to action. So it invokes a little bit of a sense of competitiveness. Why am I doing so much worse than my most efficient neighbors? What could I be doing differently? Kind of spurs you to think about that. So with that as background, I'll jump into the cases. The first one is a project we've just completed with Murray Stopes International in Nepal. And this is in the broad area of reproductive health, and specifically about the uptake of long-acting reversible contraception. So I'll give a little bit of background on this. So also someone just like say when I'm at 15 minutes or something, so I'll know if I need to speed up. So basically, why do we care about family planning? Probably don't need to tell this audience. You know, there are a bunch of reasons why the uptake of family planning has not been as high as one might hope, which means that while, you know, fertility intentions in many places have changed, there hasn't been as much of a reduction in actual fertility, and so, you know, countries are further from achieving the demographic transition than they might be. And what has happened, though, is that there has been an expansion of supply, and there has been an expansion of a lot of other services, and so you have to wonder what's going on in terms of the uptake of some of these things. Are there other more behavioral barriers, not just cost, not just access, some which are still issues in many places, but are less issues than they were, you know, some time ago that we could be exploring. So this project was actually part of a portfolio of projects that the Hewlett Foundation funded, because they were really interested in this question of saying there's a bit of stagnation in the field of family planning. We have a bunch of good interventions, a bunch of good things that we know are helpful, but they seem to get us up to a certain point, and then, you know, things aren't moving. Could we try to shake things up a little and try to do things that perhaps would be a bit unusual in the family planning world? And then specifically, this project looks at what that field calls LARCs, which are long-acting reversible contraceptives, which, you know, for clarity, just think of them as IUDs. So not the pill, which is something you have to take regularly, so not a condom, something which has to be used each time, but an IUD. There are a couple of other things, like some kinds of injectables, which are also LARCs. So these are very effective. They're often, you know, they're really sort of ideal in some ways behaviorally, because unlike something like the pill, which you have to remember to take on a regular basis, this is something which once inserted, you know, is going to last for a certain amount of time. In fact, and you can take it out at any point if you decide that your intentions about fertility have changed. So there are obviously many reasons why take-up of LARCs could be low, but we wanted to look at what the role of maybe some of the understudied factors might be. The partner here is Murray Stopes, and this was actually an interesting context. Particularly when one is venturing into this sort of field of something like contraceptive uptake, there are a lot of issues around things like coercion, or things like, you know, you want to be sure that you're not forcing things on people that they don't want. And so one of the things you look for, or that we look for in taking on a project like this, is to say, well, is the population that we're working for, does it look like they actually want contraception at all? I mean, it could be that they don't. It could be that these are women who actually do want to get pregnant right now, in which case, why would we want to push any form of contraception on them? And so what Murray Stopes was interested in was particularly looking at post-abortion women. So these are clients that they have who come to their clinics for an abortion. So almost definitionally, this is a woman who's saying, I don't want to be pregnant right now. And so what they're also seeing is a lot of, they're the biggest abortion provider in Nepal. They do about, you know, over 2/3 of all safe abortions in the country. But they're also seeing that there's a lot of repeat abortion where that's really being used as a form of contraception. And so their ask was, we know that that's not an optimal way for a woman who's coming in for an abortion the first time to kind of manage her fertility over time. These women, to us, seem to be prime targets for other kinds of family planning, yet we see that uptake is low. What could we do about that? So, and sort of the baseline number is when we started this project, about a quarter of safe abortion clients at MSI took up LARCs. Is that 15? Okay, perfect. So we did a bunch of work to try to understand what was going on in the context, qualitative work with providers, with patients, and uncovered a lot of stuff on the patient side, which I'm not going to go in here. But on the provider side, it seemed that on the one hand, providers were extremely motivated to do what they were doing. They were very well trained. They were good at counseling, all of that, good availability of supplies and so forth. But there was a lot of inconsistency in how post-abortion women were counseled about LARCs. And so part of what was going on was that there was this sort of classic behavioral pattern of decision making in times of scarcity. So time is scarce, you have a lot of women to see, and so you make these sort of snap judgments about which woman is or isn't actually going to be at all interested, and you skip a lot of steps in the process. And one thing that was happening is that there were a lot of missed opportunities for counseling on contraception. But yet when you, so this was going on, but when you talk to the providers, they would also say, well, my clinic is, or my case is special. So I work in a very remote clinic and the women here don't want long-acting contraception. Or I work in a very urban clinic, the women are very busy, they don't want contraception. So you'd hear these sort of different reasons why they were special. And so they had these performance targets that MSI was giving them, but they didn't really think the targets were relevant and they were sort of ignoring them. So what we thought was, it might be useful, but there were these interesting variations in sort of LARC uptake, even among very similar clinics. And we said, would it be useful to just tell people, only comparing your clinic to other clinics which are very similar to you in terms of the demographics and patient flow and so on, how are you doing on this metric? And so the intervention was this very simple thing. Someone at MSI, our project manager, would calculate at the beginning of each month what the previous month's LARC uptake rates had been for post-abortion women in each clinic. They'd already been split into these groups that had comparable clinics in them, and then this poster would be created, which would just tell you, are you doing better than average, are you about average, are you doing worse than average? And it would sort of prompt the providers to have a conversation to see if they could do anything differently. So since we're at 3IE talk, I should at least spend some time talking about the evaluation design. So this was a stepped wedge. We didn't have enough clinics for a straight treatment control. But with a step wedge, you can increase power a little, because what was essentially happening is over time you're randomizing more and more groups of clinics, in this case, into treatment, so that by the end, everyone's in treatment. It has another interesting side effect that I'll talk about at the end, but this is sort of the pattern that was done. And here we're only tracking what's happening to LARC uptake. So we're not looking at any further health indicators, and so there was no additional kind of survey data collection on these clients. So these are just some balance check stuff. The only thing to point out is there is something going on with fewer women in treatment being classified as post-abortion. And so one thing that I still need to check is what could be happening is that they're sort of they're not classifying women in the same way when they come in, because now they know they're in this treatment. We have tried running the results with just all women and all safe abortion clients, and it doesn't seem to change, but there's probably a couple more things we could do there. But otherwise, seems to be roughly balanced what's going on. This is just the estimation equation. It's a sort of a standard treatment effect that we're trying to calculate. And this is what we wind up with a few different sorts of formulations for fixed effects, whether we have the age covariate, and finally we include a linear time trend, because there is, remember that now that we have a step wedge, every clinic eventually is in treatment, and there is an overall upward trend in LARC uptake, so we need to make sure we control for that. Otherwise we'd be spuriously attributing a bit more of the change to the intervention than we ought to. But frankly, when we do all of that, it doesn't change very much. And so, depending on which estimate you like the most, it's sort of between, I'd say, 8.5 percentage points and 9.5 percentage points, which is about 30% of where we started. Because if you remember, the base rates are at about 30% for these clinics, right? So it's a pretty sharp jump in LARC uptake. So these are some of the things I still want to look at. So some I mentioned already, but also we want to look at whether the initially high-performing clinics, was there any kind of, was there something where they started doing worse? Because you might think there would be some complacency that came in. And there's all of these questions we can really only explore somewhat using the data, but mostly using some of the qualitative work we've done, so mystery clients and provider interviews, to understand whether there was any coercion that was Were they kind of being too pushy about giving women locks and stuff like that? And we'd love to look at obviously some cost effectiveness of the intervention and whether we can unpack some of the mechanisms. So qualitatively, we have a sense that one of the main things that was happening is that they started counseling women when they were in recovery, which actually is a much better time to having that conversation than when you're just about to go in for a surgical abortion, which is when they would do it. But we can't be kind of sure that's exactly what's going on. The one nice thing is that this stepped wedge design means that by the end, the intervention has scaled across MSIs. So by the end, all 36 clinics are getting posters. And fortuitously, we have good effects, because what we learned from them was that even before we'd done the data analysis, the nurses loved the posters. And so they've continued doing the posters after the interventions officially ended, which would probably not have been a good thing if we found big negative effects, but luckily we're not. So that's not too bad. And so we're talking to them now about, in fact, whether other countries in South Asia, there might be scope to try something similar in this. So I probably don't have too much time, so the other two I'll be a little briefer. Both of the next two are about resource use, so a very different domain, right? So now we're talking about either water or electricity. And the water project is a joint project with some colleagues at the World Bank, and it was in this place called Belén in Costa Rica. I'm going to jump over this, some general reasons why we might want to think about behavioral stuff. And so again, I think sitting in Delhi, we don't need to convince anyone that water scarcity is an issue, especially in cities as they grow. It's something that many cities are trying to tackle. And typically what you do is, you try to fiddle with prices to the extent that that's possible. There are often a lot of constraints on what you can do with prices, both for kind of economic reasons, but also political reasons for completely understandable criteria. And in this particular case, the city came to the World Bank and said, could you work with us, because we've tried a bunch of things. We've tried, doing stuff with prices. We've done a lot of information campaigns which try to tell people that it's important to save water, but we're not really seeing much traction. None of this was, prior to this, had been kind of evaluated using an RCT, so we have to take them sort of at their word in terms of what happened. So we seemed like an interesting setting in which to look at whether behavioral interventions could have some value. And these were some of the things that came out of focus group discussions with the residents. And a couple, as you can see, is there was this lack of, people sort of thought it was a problem in general, but it wasn't a problem for them, right? So yeah, people use too much water, but my water use is completely justifiable. And it turns out they didn't really have any way to know. They knew how much water they were using, but it was in cubic meters on their bill, made no sense to people. So they would ask you things like, how many buckets is that, and that might be a better metric. And also, how does that compare? I mean, is that too much, too little? How do I know, right? It feels normal to me. And then there was sort of stuff about, even if I do think I do too much, use too much water, what can I do? Water is hard to change, right? Because you're like not going to stop taking showers, you're not going to stop washing clothes. So what can you really do is sort of what you hear. So we ended up with these 3 interventions, 2 of which were really just variants of the same thing. They were, again, a peer comparison intervention where we said, we're going to put a sticker on the water bill, which based on your water consumption in the last month will say you were either above or below the average. In one case, the average was your neighborhood. In one case, the average was the whole of Belén. Belén is not a big city. It's a moderately sized town. So you would think maybe this wouldn't matter too much. But as you'll see, it does seem to make a difference. And the third thing also, it's a bit of a portmanteau intervention. We call it plan making. I'm not sure that's the best name for it. It was basically, it was trying to see how how easy we could make this intervention. So in this case, in the first 2 cases, somebody has to look at the data and figure out whether a household is above or below the relevant average. In the third case, we're basically asking the household to do that themselves. We're saying, here's the average. Look at your bill and see whether you're above or below. If you're above, here are some ideas about what you could do to reduce your water consumption. Pick one of them or more of them, as you will. So I'm not quite sure what to sort of really call that intervention, but it's sort of a mixture of a couple of things. One thing that I thought was sort of worth mentioning here is we're working with very, very strict operational constraints. So our original idea was we'll redesign the bill, and the city said we can't afford to do that, right? And certainly the bank is not giving us enough money to allow us to do that. So this is our water bill. That's an actual bill and water bill. There's this, I haven't quite managed to make it fit on this diagram, but there's this little white space at the bottom, and they said, okay, whatever you do, if you're doing it on the bill, it has to just go there. And so the sticker was designed to basically just be able to be stuck on there, and the postcard was just sort of clipped onto it when we sent the bill out. And basically there's one person in this small municipal office who had a spreadsheet which we had built some macros into, and this guy was going to do all of this manually, like stuff the envelopes as they went out. So it had to be really, really simple. So whenever I mean, this is actually a paper that is being revised right now, and one of the comments I got the last time around was, why are they different colors? And and I was sort of like, well, they're different colors because you really had to make it easy for a person to do this quickly, right? And so there are, if this were a true lab experiment, yeah, you wouldn't want to vary the color, but we did. So we ended up doing this pretty standard RCT in this case, 1 control, 3 treatment arms. There were about 1,400 households in each arm, 1,400 control and 1,400 in each. And it was a one-time intervention, which is worth remembering. So there was only one bill in July 2014, which had these stickers or the postcard on it that went out. And then we tracked, again, using administrative data, we tracked the water use over time. We can jump over this. Seems like our randomization was more or less valid. And then we get to the results. And again, here, so what you're seeing in terms of the effect sizes are all in cubic meters. So when we talk about percentage increase, we have to sort of scale that by the average for the control, which is what I'll present in a second. But you see that the neighborhood comparison has sort of consistently negative impact. So it's reducing water consumption, and it's significant. The exact magnitude obviously varies depending on the specification. The postcard has very similar effects. The city comparison is also negative, but is never significant. So it's just small enough. It's smaller enough that you don't see it as significant. So interpret that as you will. I interpret that as clearly the neighborhood is more effective, perhaps because the comparison is being made to a group that's closer to you in kind of socioeconomics and in other ways. But you do see something from the city as well. It's just not significant with our sample. So this is sort of roughly what it looks like in percentage terms. So depending on the specification, you're seeing about a 3.5-ish to 5.5-ish% decrease in water consumption. And interestingly, because this was admin data, we were able to keep tracking this for a while. It wasn't as easy as it sounds, because basically each time someone from the World Bank went on mission, they would drop by the mayor's office and say, could we get a couple more months of water use data? And then they would put it on a pen drive and give it to them. We never quite managed to make this a bit more streamlined and ongoing. But what you see is the results do attenuate over time. So those long red bars are kind of the confidence intervals. And so after about 4 months, they're still negative, but they're no longer significant. But remember, it's a one-time intervention. So we don't know what would have happened if we'd done it again or had sort of repeated it at some point, but it's interesting. So you can see it in a different way, that you are seeing a reduction in the effect size over time. So this was like ridiculously cheap, right? So basically the cost was some of the time of this guy who was doing this stuff. It was our time. We certainly had a very small contract from the World Bank, and it was the World Bank's time, which was part of this lending package that they already had with the government. So it was a very cheap intervention. It's difficult to do sort of, we haven't done very good kind of cost-benefit stuff on this, but sort of anecdotally, what the mayor of Belen said is that I love this intervention because if we can keep doing this and we can maintain roughly this magnitude of reductions, it's pushing back my timeline for when I need to sink the next major well to extract water by about 5 years. So it's a big change in his city's budget. So that's sort of the way he looks at it, which I think is a great way to think about how effective this is. And so finally, here's a peer comparison intervention in Cape Town, South Africa, which is looking at an office building context. So we were doing a bunch of projects with the government of the Western Cape. And one of the remits was to work with the Department of Environment and Energy and see if we could do something about resource use. And we ended up saying, the government is actually a major employer, and you spend a lot of time telling people in the city that you should be reducing your power consumption. What if you were to work on yourselves? What if we were to work on government employees? And the office setting is an interesting one, because you might imagine in some ways that price levers are even less effective here, because typically, like none of us right now are paying like ISC's electricity bills, so we have no incentive to financially to sort of turn stuff off or conserve. And also it's very unclear whose job it is, right? Who's going to turn the lights off when we leave the room? I mean, it's really nobody's job. And so Also potentially, therefore, a tricky area for behavioral stuff, because the same stuff in some ways applies. If I tell you something, who does it apply to? But it's worth sort of wondering whether we can do something there. And certainly it was an interesting context in this specific office building. This was, we were going to work in the biggest office building that the Western Cape government has, which is also where the Premier's office and various other things sit. And you can see that on average, employees in the Western Cape government are using per capita a lot more energy even than other employees in sort of companies in the area. So maybe I don't have too much time to go over this, but I'd say that the couple of things I'd pick out is that it's not as if Western Cape government employees were sort of, not interested in reducing electricity consumption, but all of the stuff we just talked about, where it wasn't clear whose job it was, they didn't really think that anything they were doing was out of the ordinary in terms of electricity consumption and so on. All of these were at play, and so it felt like we might be able to do something with an intervention. So here was the intervention idea. We'd do an interfloor competition. So this was a building with about 24 floors, not all of which were usable for the thing because something was under construction, and there was a couple of other things. One floor had a lot of servers in it, which didn't really make sense to compare with anyone else. But we had about 21 usable floors. So we said we'll randomize them into groups of 7. And I used randomize here fairly loosely. It was kind of some matching. We didn't really have enough data to be able to do a very, very clean randomization. But the first intervention was just going to be an email that goes out every week to employees on the floor, and it tells you how your energy consumption compares to other floors in that past week. And then has some prompts for thinking about what you could do to change stuff. And then the second element was going to be randomly assigning one employee on each floor for the week to be the energy champion. So basically, if Divya is that person, then she gets an email saying, hey, Divya, you're the energy champion for this floor for this week. And the rest of us get one saying, Divya is the energy champion for this week, so don't be surprised if she comes around and is nosy and asks you to turn things off, and don't get offended, right? So that was kind of the idea. So we ended up doing one treatment was just the interfloor comparison, and the second treatment, which was both of these elements together. And they would happen each week. There would be an email that would go out. So what I'm going to skate over is the fact that this thing took years to actually get off the ground, because you're working with a government IT system and you're working with a government public works department. So first it took forever for the meters to be installed, and the meters didn't work. Then they'd written a really bad contract with the meter provider. I mean, this I could spend hours on this. I won't. But suffice it to say that what we're calling the full fidelity rollout only happened in June 2016, although we'd probably finished these intervention designs back in, and the emails were all ready to go back in end of 2014. I had mentioned some co-authors in this at the University of Cape Town. It's their perseverance that made this happen, because we by then had run out of money. We were no longer in South Africa, but they somehow kept going and made it happen. And we're looking at the moment at 4 months of post-intervention data to see what the effects are. So this is what we're seeing so far. So we're looking at there's a difference in difference estimator, right? So we're looking at how much did energy consumption change in the treatment floors versus the control floors. And what you're interested in is those interaction terms, which is the treatment interacted with the post period. And what you see is that both treatments have negative effects, but one of them is not significant. The other one, which is the combination, is much bigger, and it has a significant effect on electricity consumption. So these are again in kilowatts hour per 30 minutes, so we'll have to sort of translate these into percentages, and they're really quite big. So this is what they look like when you look at percentage-wise. So that's about a 13.5% reduction in energy use. And the first one, which is not significant, I should point out, it's not clear from that image, is about 7%. So that's sort of roughly what we're seeing in terms of electricity use. And maybe the last thing I should say about this is that so we did see some attenuation over the period that we're looking at, but they're broadly, it's not huge. So you're seeing the same patterns as you look at initially 1 month of data, then 2 months, then 3 months, and then 4 months. And so it seems at that point to be roughly stable, and it's not as if people are going back to their old habits. What I don't have here is we've begun to do a little bit of work to see what's driving this. And what's really interesting, this again, will make more. When I explain this in the US, they have no idea what I'm saying, but I think Indians will get it. So one of the major contributors to electricity use in these office buildings is that these floors tend to have an office kitchen at the end of the corridor. The office kitchen has a geyser, and no one ever remembers to turn the geyser off when they go home and on the weekends. And when we look at the data now, what we can see is that most of our treatment effect is coming outside of office hours. So basically, somebody was going and turning that thing off when they left, right? And that was something we identified initially as that would be a good behavior to try and nudge, but we weren't sure if like making it that specific to that would be useful, but people seem to have figured that out. So that's our guess, that that's what's going on. Plus, of course, turning lights off and unplugging computers and so on, but we suspect that the geyser is a big part of it. In the US, nobody knows what a geyser is, so they're like, what are you talking about? So that's this intervention. So just sort of some final thoughts, if I have a couple of moments about why talk about this stuff here. I mean, on the environmental behavior stuff, I think these are two experiments, but if you think about the Opower stuff, you think about other things that have been done on water using some kind of social norms peer comparison intervention. These have been effective in many different settings, and it feels right to try these interventions at scale in different contexts. And I think there's a lot of scope to try this stuff in India. We know that it's incredibly tricky to do, changes to pricing and various such things. There's also an added, I think, incentive perhaps in a developing country context, which is that you do want people who have access, which is not everyone, you do need them to be kind of using resources efficiently or sparingly, in part so that you can then think about extending access to people who don't have it. I mean, I know this is a very idealistic view of policymaking, but at least one can begin from that premise that maybe there's something there. But we have to think a lot about how these interventions can be made more long-lasting in their effects, and how sticky are these effects, and so on and so forth. And then on the MSI intervention, I think more broadly, there is, this is an issue that applies to frontline workers in many, many domains. So whether it's education, whether it's health, it's sort of hard to know how well you're doing. And of course, we have to be careful about sort of unintended consequences of kind of channeling people in one direction and they don't do some of the other stuff they're doing. But certainly thinking about health worker behavior, but thinking about health worker kind of decision-making contexts, which are incredibly overloaded with many, many tasks and very burdened by scarcity. What can we do to alleviate that? What kind of tips or helpful nudges can we provide to really get the kinds of outcomes that we might be interested in is definitely worth thinking about. Obviously, much more complicated to do this, for instance, in a true government setting where MSI is a pretty, they have their act together as far as basic service delivery is concerned, right? That's not going to be the case once you're looking at a huge number of, say, Anganwadis. It's not going to be as standardized. There won't be the same systems in place. But, I think it's worth thinking about. But even more broadly, perhaps, this sort of stuff about human decision making is central to many, many things that governments are trying to do as policy imperatives. And the behavior angle isn't always given as much prominence as it could be. And perhaps there is scope to do more work there and to see what we can do to sort of incorporate some of these simple nudges into the way that policy is rolled out and see what kinds of effects it has on outcomes. So, yep, I'll stop there.